Harold's wife came home from rehab with a bill for close to $17,000. They had both been told plainly that Medicare covers 100 days of nursing care. It does, and it doesn't. Both halves of that sentence are true at the same time, and the gap between them is where families get hurt. So what does 100 days actually mean, and why did Harold still owe thousands? Today, in plain English, I'll walk you through how Medicare's skilled nursing benefit really works in 2026, the part that's free, the part that isn't, and the one myth that makes people give up on care they're still entitled to. Let's start with a number everyone remembers: 100 days. That part is real. In each benefit period, Medicare's Part A can cover up to 100 days of skilled nursing care. But cover does not mean pay every dollar. It means Medicare pays on the sliding scale, and the scale has a sharp step in the middle of it. Here's the split for 2026. Days 1 through 20, Medicare pays 100%. You owe nothing. That's the part people remember. Days 21 through 100, you pay a daily share of $217. That's the part people forget. Multiply it out across those 80 days, and you're looking at more than $17,000, which is exactly the bill that landed on Harold's kitchen table. And after day 100, Medicare's skilled nursing benefit stops entirely, and you're responsible for all of it. So the phrase, Medicare covers 100 days, quietly hides two cliffs: the paying share that starts on day 21 and the full stop at day 101. Now, before any of that even applies, there's a gate you have to pass, and we covered it in the last episode. To get this skilled nursing benefit at all, you must first have a qualifying inpatient hospital stay of at least 3 days. If your hospital stay was observation, those days don't count, and this benefit never opens. So the 100-day clock only starts for people who cleared that door first. And here's the myth that costs people the most, not in dollars, but in care they walk away from. Have you ever heard that Medicare stops paying once you stop improving? Almost everyone has. It isn't true. For years, families and even some facilities believed that if a patient plateaued, stopped getting measurably better, Medicare would cut off the skilled care. That belief was so widespread, it took a federal court settlement to correct it. The rule is this: Medicare can cover skilled care when it's needed to maintain your condition or to slow a decline, not only when you're expected to improve. So a stroke patient who has stopped improving but still needs skilled therapy to hold their ground can still qualify. If you're ever told you've plateaued, so Medicare won't pay, that is your signal to ask again and to appeal. Why does this myth survive? Partly because it's simpler for a busy facility to discharge someone who isn't progressing than to document why maintenance care is still skilled and necessary. The paperwork burden points one way, and the patient loses ground the other way. No villain, just an incentive nobody corrects for you. So let's make the numbers stick. In 2026, days 1 to 20, you pay nothing. Days 21 to 100, $217 a day. Day 101 and beyond, everything. And none of it starts without that 3-day inpatient stay first. Which raises the obvious question: if days 21 through 100 can cost $17,000, who pays that? This is exactly what a good Medigap supplement is built for. Most supplement plans cover that daily skilled nursing share in full, turning a $17,000 exposure into zero. It's one of the quiet, unglamorous reasons a supplement earns its keep, and something to weigh long before you ever need rehab. So tell me in the comments, were you ever told Medicare covers 100 days and left to discover the fine print the hard way? I read every reply. Here's what to do. If a rehab or nursing stay is coming, ask 2 questions before you go in. Do I have a qualifying 3-day inpatient stay? And what will I owe on days 21 through 100? And if you're ever told coverage is ending because you've stopped improving, don't accept it quietly. Ask whether skilled care is still needed to maintain your condition, and file an appeal if it is. And if you want a real person to help, free, no sales pitch, call your state health insurance assistance program, your SHIP counselors, or Medicare at 1-800-MEDICARE. They can check your days, your status, and your appeal rights. because Medicare covers 100 days is one of those sentences that's true enough to trust and incomplete enough to hurt you. The dates and the dollars are what protect you, not the slogan. So tell me below, did the 21-day cliff catch your family off guard? If this cleared it up, subscribe. Next, we follow the care home health, what Medicare actually pays for, and the aid you need that it often won't cover. This is general information, not medical or financial advice, and we are not affiliated with Medicare. Always check your own situation. I'm glad you're here. I'll see you in the next one.